Good morning, Sarah ma'am. In this next 1 minute, I am going to show you a very innovative technique of fixation of dropped AIOS type IOL with the help of just 90-proline. The advantage of such a technique is that first, I have not made any corneal astigmatism, I have not made any corneal incision, just a small with side port, no scleral incision, intra-op IOP control is good, there is no post-op astigmatism, and in the last it's the cost effective because I have used the same IOL. And one more advantage of this technique, I have used a partial scleral groove. So post-op there is no visible 90-proline or that knot. Thank you,
So,
sir.
at what only problem with this type of technique is that when you are trying a suture and on both the sides, whether they are at the same place or not, may be difficult to decide.
Sir, it was a 4-point fixation and I have used 2 mm and 2 mm and it was well centralized.
No, I mean, you are
Sir.
trying to fix the haptic over there.
Yes, sir. Sir, I have fixed, there was no sulcus support because there was IOL
No.
back complex drop.
By
Yes.
suture, you are fixing the haptic to the sclera.
Yes, sir.
So this is what I'm saying, at what place of the haptic your suture is staying may not be determined very easily.
Yes, sir.
So it may be slightly more on the one side or the other side, maybe towards the tip or maybe where there is a optic haptic junction.
Sir.
So having the both sides equal and same place may be difficult.
It's definitely,
So
sir.
the
Sir.
only, this is slightly difficult technique, maybe all right for VR surgeons. And I personally feel that putting an exact centration may be a little
Sir,
difficult.
sir.
Because
Sir.
when you are passing a suture in such a complicated technique, and even the suture may slip on this way or that way.
Sir, but it's not a very complicated technique. I will just.
But the whole procedure is being done literally in the vitreous cavity. You're not even.
Yes, ma'am.
It's
Ma'am.
just in vitreous
But
cavity.
I've done. This is
No,
my.
we know that.
You
We have,
have
seen,
done,
we
but-
have seen many of the videos. My only concern is that it may be having the perfect centration may be an issue in these cases.
Sir, in most of the cases, I have done, this is like AIOS type IOL, I have tried PMMA also, I have tried via passing the hole, I have tried all the lenses, the centration and there is no, as such, no post-op astigmatism is not much.
I think excellent technique and most of the VR surgeons have been doing it.
Sir.
And we have been seeing it, particularly one-eyed patients, highly myope patients, where you don't have to really open up the anterior segment to take it out. So it's a closed chamber technique.
Yes, sir,
Very
sir.
good technique. There is absolutely no doubt there with a lot of benefits.
Sir.
And once in a while, of course, if the biometry is not correct, patient may have a refractive error
Sir,
afterwards.
I have asked, like before fixing the same IOL, my first question is, were you happy with your previous, were you happy with the IOL when IOL was in place? They said, we are happy. Then I said, I will try to fix it. If it's not done, then I will put the another lens.
Okay.
Sir,
Anyway,
thank you,